Well, today we were talking about how personalized health is getting implemented within the Canadian healthcare system, and where we've learned from both the European experience and how we've learned in Canada and how we're sharing the ideas between both. Well, in Canada, we're challenged that we have a very large country with a fairly small population of 35 million people. And so we've had to be able to deliver equitable, personalized health care to that diverse population. So we have a lot more challenges with respect to geography. But through that, e-health innovations, which are something that Europe has been doing for years, has really helped us with respect to some of the applications and implementation of that within our system. So certain health apps that are being used to be able to follow a patient's experience, to be able to go forward. So patient navigating allows them to be able to take control of their own experience. So that puts it in the hands of the patient, puts the data in the hand of the patient, puts the opportunity in the hand of the patient. And I think that is something that doesn't really matter whether you're rural or urban, you're able to be able to take control yourself. It's going down very well with patients. Patient empowerment is something that I think is now international. I don't think it's limited to Canada or EU or the States. Patients now are educated. They have access to the internet, so they're able to look up a lot about their disease or their situation. And so I think they want to be empowered now. Some of the concluding points is that we've been able to do a lot of joint funding for researchers between Canada and countries within the EU. That those projects have now come to fruition. We're starting to see the opportunity to take genomics, someone's DNA fingerprint, be able to apply the appropriate medicine to them. The one, I think, big example is in the area of rare diseases, where in one country you cannot tackle a certain disease because it's so infrequent. But working together, we've been able to, the research community between Canada and the EU, have been able to clone a lot of rare diseases, and gives those individuals hope that there'll be a medicine that they would be able to then have. And I think at the end of the day, they've worked on 637 different genes that have caused rare diseases. I think the list is growing daily through that collaborative effort. Well, I think everyone might have a slightly different point of view on it. I mean, certainly the big data revolution is not new to credit card companies. They follow us wherever we go. The question is how much can we follow with someone's health records? And how do we protect privacy, but still able to really share what's important to learn from to provide the best health for citizens independent of where you live.